Mr. Alonzo had been enjoying a friend's wedding when he was unexpectedly taken ill. In emergencies like this, rapid diagnosis and treatment can make all the difference to a patient's long-term recovery. Thanks to mobile data communications, the ambulance paramedic is able to securely access Mr. Alonzo's medical records and monitor his condition on the way to the hospital. Better collaboration between the paramedic and the ER means life-saving treatment can be administered in the ambulance and continued at the hospital. The patient's electronic patient record is accessed via a Cisco mobile router in the ambulance, which securely connects to a central hub. The nearest hospital is identified and the appropriate medical staff alerted in response to the patient's condition. When Mr. Alonzo arrives at the hospital, personnel are already waiting. At such a distressing time, it's reassuring to be greeted by someone who knows his name. Dr. Patel accesses Mr. Alonzo's medical records on a tablet PC, which saves time manually searching records or printing off notes. He decides Mr. Alonzo needs some medication and is able to check for any allergies or non-allergenic reactions. As the order for the drugs is entered, Mr. Alonzo's records are automatically updated, reducing administrative paperwork. Dr. Patel decides to transfer him to the cardiac unit for closer monitoring. The nurse checks the availability of a bed and books a porter and any equipment needed. An automatic message is also sent direct to the cardiac unit, alerting them of Mr. Alonzo's transfer and medical condition. As soon as the booking is made, a request is sent to the nearest available porter to transfer Mr. Alonzo as soon as possible. All portable hospital equipment is tagged with its own unique identity, so its location is known. Equipment can then be checked for availability via the wireless network, making more efficient use of hospital resources. Mr. Alonzo is soon feeling a little better and is sitting up in bed. Fortunately, there are plenty of things on the IP patient terminal to keep him occupied and informed, including patient education materials. His friends decide to give him a call and find out how he's doing. The next day, Dr. Jones decides Mr. Alonzo is fit enough to go home. He is able to discharge him, completing all the necessary paperwork at his bedside, and even arrange transport if needed. All the main areas of the hospital, from admissions and records to individual mobile devices, are linked together through one secure, scalable medical-grade network. It also connects to other hospitals, as well as local health centers, welfare organizations, and government departments. This eliminates needless journeys, improves information sharing, and speeds up communications, cutting waiting times and improving patient services. Unfortunately, a few days later, Mr. Alonzo's symptoms recur. He arranges an appointment with Dr. Stevens, his local doctor. He makes a priority booking request online and sends a note describing his symptoms. Dr. Stevens feels he needs a more comprehensive diagnosis and decides to ask Dr. Roberts, a leading cardiologist, for a second opinion. He is able to view Dr. Roberts' diary and book a video conference call for later that day. Video conferencing makes better use of professional expertise. Thanks to Cisco, they are able to share notes and applications instantly. Dr. Roberts decides Mr. Alonzo needs an angiogram and books the next available appointment. A few days later, it's time for the angiogram. Using the latest digital imaging technology, the results are instantaneous. The high-resolution digital files are transferred via the Cisco medical grade network and stored alongside Mr. Alonzo's medical records. A written diagnosis and interpretation are available to his local GP. Later that week, Mr. Alonzo has a video conference call with his doctor. There's no journey to the surgery and no waiting around. The news is good. His heart is improving. With a little rest and the right drug treatment, he will be back to full health in no time. That leaves plenty of opportunity to catch up on that wedding he missed. Using a Cisco medical grade network and the healthcare solutions it enables, hospitals are able to make information and knowledge available securely to the right person at the right time. From the initial emergency call to the identification and notification of suitable personnel, equipment, and facilities, the Cisco network links together all the hospital departments as well as other healthcare professionals and organizations in the wider community. Cisco Unified Communications means users can access information where and when they need it, across a variety of devices, helping to seamlessly deliver improved workflow and better patient care.